Bismillahirrahmanirrahim. In this video, we'll discuss what are the antibiotics that inhibit the bacterial cell wall. And in general, this is the antibiotic classifications according to the site of action. And we will focus on the antibiotics that inhibit the cell wall. We have two groups of antibiotics. We have beta-lactam antibiotics, and we have a glycopeptide and the glycolipopeptide antibiotics. The beta-lactam antibiotics, we have a penicillins, cephalosporins, carbapenem, and monobactam. And the glycopeptide antibiotics, we have vancomycin and teicoplanin, and we have glycolipopeptide antibiotic, we have a dalbavancin and telavancins. And this is the general classification of the antibiotics that inhibit the cell wall. Let's start with beta-lactam antibiotics. The beta-lactam antibiotics, all beta-lactam antibiotics contain anti-beta-lactam ring, and this ring. And this general classification of the beta-lactam antibiotics, we have a penicillins that are subclassified into natural penicillin, penicillinase R, aminopenicillins, and extended spectrum penicillins. We have a cephalosporins that are classified into 5 generation, first, second, third, fourth, and fifth generation. We have a carbapenem that are classified into mepenem, meropenem, and ertapenem. And we have a monobactam, and this astronym is an example of the monobactam. And this is the general classification of the beta-lactam antibiotics. All these antibiotics share the same characteristic that they have the beta-lactam ring. Let's start with the penicillin, and we'll follow the same scheme during discussion of each antibiotics. We'll start first by the spectrum of the antibiotics. Then we'll discuss how it acts, it's type dependent or concentration dependent. Then we end by discussing the adverse effect of these antibiotics. So this is our spectrum in general. For natural penicillin, it covers only strep, but there is no other coverage for any types of antibiotics. For methicillin, it covers strep and methicillin staph or methicillin sensitive staph aureus, but it doesn't cover methicillin resistant and any other types of bacteria. For aminopenicillin, it have some activity against enterococcus and some activity against gram-negative bacteria. And for extended spectrum penicillin, piperacillin, it have anti-pseudomonal effect and it covers the anaerobic effect. So this is the main characteristics difference between the different classification of the penicillins. For cephalosporin, the first generation covering strep and MSSA, methicillin sensitive staph aureus. The second generation, it increased the spectrum to include some gram-negative and have anti-pseudomonal effect. For the third generation, ceftriaxone, it covers strep and methicillin sensitive, some gram-negative, but it doesn't have any effect on the pseudomonas. For third generation ceftazidime, and this is the main difference between the ceftriaxone and ceftazidime. Ceftazidime doesn't cover any type of the gram-positive, but it covers the pseudomonas, so it have anti-pseudomonal effect. For the fourth generation cefepime, it covered the gram-positive, gram-negative, and pseudomonas. And for the fifth generation ceftaroline spectrum is the same like ceftriaxone. The only difference between ceftriaxone and the ceftaroline covering methicillin-resistant Staph aureus. But all types of 5 generations of the cephalosporin doesn't cover the anaerobes and doesn't cover, and they don't cover the atypical bacteria. For carbapenem, for meropenem and imipenem, they have effect on the gram-positive but not MRSA, gram-negative anaerobes but not atypical. For ertapenem, it has a similar coverage to the carbapenem, to the meropenem and imipenem, but it doesn't cover the pseudomonas. Lastly, for monobactam, the monobactam, it's purely against the gram-negative, especially for anti-pseudomonal effect, but have no coverage for gram-positive anaerobes or atypical bacteria. The beta-lactam antibiotics are time dependent, so sometimes the continuous infusion may be recommended, especially in the highly resistant bacteria. What are the adverse reactions related to the beta-lactam antibiotics? Some beta-lactam inducing seizures like cefepime and imipenem, some of them producing coagulopathy like cefoperazone, some of them has an allergic reaction. Penicillin, 10% of the patient have sensitivity for penicillins. And keep in mind the patient with allergic to the penicillin, 2 to 5% of these patients having cross-reactivity with cephalosporin. Some of them reduce Clostridium difficile overgrowth and it causing like carbapenem and cephalosporin. And lastly, some of these antibiotics have an hepatic toxicity like amoxicillin clavulanic acid. The second group of patients that act on the cell wall glycopeptide. The glycopeptides are purely antibacterial against the gram-positive infection. It covers strep, methicillin-sensitive Staph aureus, methicillin-resistant Staph aureus, some Enterococcus, and it covers the gram-positive cocci, gram-positive anaerobic bacilli like Clostridium difficile. But there is no coverage on the gram-negative Pseudomonas or atypical. The vancomycin have two types of action. It can be treated as given as a time-dependent antibiotics, like loading dose followed by continuous infusion. It also can be given as a concentration dependent, which means by loading dose followed by intermittent bolus. For the intermittent regimen of the vancomycin, we give loading dose without renal adjustment, followed by maintenance dose at regular interval. And for continuous infusion regimen, we start by loading dose again without renal adjustment, and we start by infusion 30 to 40 milligram per kilogram over 24 hours. And these types of infusion started immediately after completion of the loading dose. These two types of regimen for administration of the vancomycin. For teicoplanin, the loading dose will differ according to the creatinine GFR or creatinine clearance, like as shown in this table. For vancomycin side effects, the most famous side effect is red man syndrome. Red man syndrome is what's called redness of the upper part of the body. Rapid infusion of the vancomycin induces histamine release and causing what's called red band syndrome, which is redness in in the neck and the upper arm of the body. Nephrotoxicity, it's dose dependent and increased, especially when administered with other antibiotics like piperacillin tazobactam. And here is the summarize of the spectrum of the beta-lactam antibiotics. For penicillin, again, penicillin G covers strep, methicillin covering strep and the MSSA, ampicillin, amoxicillin covering Enterococcus, strep, MSA gram-negative, piperacillin covering Pseudomonas gram-negative MSA strep. Cephalosporin, the first generation covering strep and MSSA, second generation covering have some gram-negative bacteria, third generation covering strep MSA gram-negative, but doesn't cover gram Pseudomonas. The third generation, ceftazidime, is different from the third generation ceftriaxone as it doesn't cover the gram-positive bacteria. The fourth generation, cefepime, have an anti-pseudomonal effect, and the fifth generation, it has the same spectrum of the third generation ceftriaxone, but it covers the MRSA. Carbapenem covering ertapenem, it have a gram-positive coverage, anaerobic coverage, and the meropenem having coverage against the similar to the ertapenem with anti-pseudomonal effect. The aztreonam have an anti-pseudomonal gram-negative but doesn't cover anaerobes and doesn't cover gram-positive bacteria. Thank you.